Hi everyone, my name is Kimia Kardan, and today I will be talking to you guys about diaphragmatic breathing, why it's important, the benefits, and how to do it. So your diaphragm is a dome-shaped muscle at the base of your lungs, and it is primarily responsible for breathing. As you inhale or take a breath in, your diaphragm lowers and relaxes, allowing space for the lungs to expand. As you exhale, the diaphragm relaxes and raises. Over time, so when we're born, and if you look at a baby's belly or a toddler's belly or even a kid's belly, you'll notice that as they take a deep breath in, their belly expands, kind of like how I'm describing is important to do for diaphragm breathing. So belly breathing and diaphragm breathing are synonymous. But as we get older, with daily stresses, with constantly being told to keep our bellies tucked in, with tightening up our abdominals through stressful life situations, oftentimes what happens is we stop diaphragm breathing and we start using our chest or our accessory muscles in our neck and our chest to breathe. Now, as I mentioned, another word for diaphragm breathing is belly breathing. So what I'm going to do is I'm going to go through the benefits of belly breathing. So belly breathing has benefits on your musculoskeletal system, your nervous system, your cardiac system, helps manage stress levels, so aids in mental health. So as far as the musculoskeletal system, as we take deep belly breaths, that helps supply our muscles, especially our abdominal muscles, as the breath comes deep down into the belly, our pelvic floor muscles, as the breath comes deep down into the pelvic floor, and our low back muscles with oxygen and blood flow. Also, it helps increase mobility in our spine, in the backside. As I mentioned, the blood flow and increased oxygen down to the pelvic floor. There is also a really important relationship between diaphragm and pelvic floor. As you can see, they kind of sit on top of each other, parallel through transverse planes in our body. So how I mentioned earlier, how the diaphragm lowers and relaxes on your breath in, well, your pelvic floor also lowers and lengthens on your breath in. So what happens is on a breath in, the muscles work together like a piston. On your breath out, they both elevate. Other benefits of diaphragmatic breathing are that it activates your parasympathetic nervous system, which is your rest and relaxed nervous system, as opposed to as if we were to do chest breathing, that would be using our accessory muscles, that would activate more of your sympathetic nervous system. Also, diaphragm breathing, because of its relationship to the pelvic floor muscles, aids in helping with emptying when you are urinating, as well as when you are emptying bowel movements while you're sitting on the toilet. So that can be a beneficial position to perform diaphragm breathing. That's because if our pelvic floor muscles are like a bowl, if we want to urinate or have a bowel movement, those muscles need to relax to allow for us to urinate or have a bowel movement. Also, like I mentioned before, diaphragm breathing increases or aids in mental health, and that's because it reduces stress and anxiety and decreases the heart rate and blood pressure. A study found that diaphragm breathing can also found a decrease in cortisol levels, as well as improve sustained attention. And lastly, the diaphragm breathing aids in GI mobility and motility. As the diaphragm lowers, it gently massages those intestines to get things going and to get peristalsis going, as well as just improving blood flow to your GI tract. Also, diaphragm breathing results in a decreased work of breathing. So how to perform diaphragm breathing? Go ahead and put one hand on your chest and one hand on your belly. So I want you guys to take a big deep breath in and notice which hand moves more, hand on your chest or hand on your belly. Now, most of you might say, oh, I noticed the hand on my chest moves more, and your chest even comes up towards your chin as you try to take a big deep breath in. Now, what I want you to do is relax your shoulders down, and on your next breath in, try to focus on expanding your belly, feeling your belly rise, really pushing the hand on your belly away. Take a deep breath in through your nose as you fill your belly with air. Good. On your breath out through your mouth, you can even do so with pursed lips, you'll feel your belly go down. Awesome. Now on your next breath in, I want you to feel this air and this breath go even lower past your belly into your pelvic bowl. So go ahead and take a deep breath in. Try to feel those pelvic floor muscles relaxing, and breath out. Awesome. So you can practice this breath in any position. I'm doing it in sitting, you can do it in standing, lying down, might even be the best position to start kind of activating that breath as you're walking, talking, working, whatever you're doing. The whole point is to try to make this breath incorporate this breath more into your daily life. So ideally, it would be awesome to start doing about 10 breaths every hour per day. And I know that sounds like a lot, but you're breathing 24/7 anyway. The whole point is kind of bring your attention back to your breath. Are you kind of holding your belly tight throughout the day as you're stressed with work, stressed with taking care of the kids, stressed with taking care of your family? Or are you allowing your belly to expand, allowing yourself to take those big, deep breaths in? So again, no matter what you're doing throughout your day, especially if you have a watch, you can set a reminder on your watch to perform the deep belly breaths. Eventually, the goal is for it to become a habit, so that you are just taking belly breaths throughout the day. Awesome. Thanks, guys.